It's good. Tonight's rally coming just 1 week after the president was discharged from Walter Reed Hospital. President Trump getting all clear from his doctor and returned to the campaign trail. Joining us now with the very latest is Dr. Oz. Good morning to you, sir. Thanks for joining us here on Good Day Orlando. Now, the White House doctor did not comment if the president has tested negative for COVID. What is the latest we know about the president's, basically what his situation is right now in terms of recovery, Dr. Oz?
Well, he meets all CDC guidelines to be able to go back to work. It's the same guidelines the rest of us would use. Now, he's 10 days since his onset of symptoms. He's improving in terms of his symptoms, and he's free of a fever for 24 hours. I believe the physician was trying to make the point that they've tested him, and although these tests might show there's virus particles in patients, it doesn't necessarily mean they have active virus. But this is in the weeds. In my studio, I would insist on another test that's negative, but I appreciate that the president doesn't have to fall under those criteria. If he meets CDC criteria, theoretically he can go out. I just want to emphasize something you heard a second ago. The president's not the big risk. It's the people around you at that event tonight. And if they have COVID-19, it becomes a super spreader event potentially when the virus can spread to person pretty rapidly. So I'd be really cautious about people around you. Wear a mask if you can. If you can stand a few feet away from the guys closest to you coughing, would be great.
Now, Dr. Oz, the president has everyone talking about the possible promise of Regeneron's antibody cocktail we've heard so much about. What does the data show about that specific treatment?
Well, I spoke to the chief scientific officer of Regeneron, actually on the show later, and he said, listen, we saw 275 patients. They did really well, but that's just a small number of people. You can't make large decisions, especially the FDA can't, with just that bit of data. But it's built on a large body of information that you can neutralize these proteins the spike proteins on the virus with antibodies. It's the same way your body beats the virus by itself. So when we ask people to donate blood and take that plasma and give it to someone who's still sick, it's the same basic principle, just a sort of refined, tuned-up version of it. So I do believe these are going to work. And this is an important issue for everyone to pay attention to, because the vaccine by itself will not get us through this, at least short term. The vaccines are going to work well. I'm talking about them later today, but essentially they work well enough, but they're not going to be perfect. And it takes a while to give them to you. It will take a while for most Americans to get them. We need therapeutics in the meantime. These neutralizing antibodies can do it.
Gotcha. Now, we talk about the average Joe, the average patient, Dr. Oz. When the FDA grants emergency use and authorization to use Regeneron's antibody cocktail, what does this mean just for the mass of people, the population? What's this mean in the long haul?
Well, I heard a comedian joke that the president went to Walter Reed. Most of us have to go to Duane Reed. And what we really have to do is, just like with the flu, you have a vaccine and you also have Tamiflu, right? You need both. And the average American is going to have to access to both. And the nice thing about the current situation compared to back in March is we've had the chance of you ending up in an ICU if you get COVID-19, just through the protocols. Not even to any magic medication, just by understanding the disease better. I do believe with better therapies, we're going to be able to improve further on that, and it'll be belt and suspenders approach together with the vaccines.
Gotcha. Now, real quick here before you leave us, Dr. Oz, got to ask your opinion on this. Over 40 vaccines right now in human trials. To you personally, which one seems most promising? Can you tell us about that?
Well, I asked that to Dr. Hotez, who perhaps the nation's leader in vaccines, and he argued that no one vaccine is going to be best for the entire population. Some of them are brand new, never been tested before, like the mRNA vaccines. That's why the FDA is asking for 2 months of a delay to assess this information. Others are built on older technology, so more proven base, but we don't know if they're going to work any better. The mRNA theoretically will be more powerful. I think for the average listener, the key message here is there'll be a vaccine that's best for you, depending on your age and gender and everything else. And all that said and done, it probably won't be 100% perfect initially.
All right, Dr. Oz, thanks so much for your time, sir. And, of course, folks at home, you can always watch Dr. Oz right here on Fox 35 weekdays at 2 p.m., so tune in right here on Fox 35. Danielle?
Jamie, thanks. 9:09 your time. The Florida Department of Health is reporting more than 50